IEP, initial enrollment period, starts 3 months before your Medicare eligibility. Let's say somebody's turning 65. Then I'll use a different one. But say somebody's turning 65. That's their Medicare eligibility month. If they're turning 65 on the 1st, their Medicare eligibility month would start the month before. The 7 months is always around the first month of eligibility. So it's 3 months before, the month of, and 3 months after. That makes sense? Everybody know that? All right, now IEP 2, what is that?
When somebody's on Medicare before they turn 65 and they get into the 65 window, they have a second initial enrollment period to get on a drug plan.
Right. So if someone becomes eligible for Medicare before their 65th birthday due to disability or something like that, then when they turn 65, they get a second IEP. It's called IEP 2. All right. So those are important because you're dealing with somebody that's turning 65. Is IEP 2 in agency block or is it just in? Yeah. So there should be an IEP 2 in there. You can use IEP 2 instead of IEP if they're turning 65, but they've already Medicare eligible. Like I think maybe Holt wrote one last week that was a Medicare Advantage disability under 65 client. She's turning 65, had moved her to a Med Sup and then used IEP 2 to change her to a drug plan, which also kills the Medicare Advantage plan. What's the fastest way to take somebody off a Medicare Advantage plan? Enroll them in a drug plan. So remember, you can't have an MA only plan and a Part D prescription drug plan unless it's a very specific type of Medicare Advantage plan called a PFFS, private fee for service, or a MSA, which there are not a lot of them around. We're not writing a lot of them. So, all right, IEP, IEP 2. SEP, give me an example of SEP, somebody. Will.
A disaster, emergency, or disaster weather.
Okay, so FEMA declared disaster periods that carriers say that they'll accept. You'd be an SCP, FEMA, DST, I think is the code if they ask for it. Loss of credible coverage. So there's loss of employer union group coverage, and then there's loss of creditable coverage. I don't know the difference. I mean, I guess you could use your imagination on how somebody would be losing creditable coverage that wasn't group coverage. It could be different reasons. Let's say they lost VA or something. That's loss of creditable coverage for the Part D side anyway. So there's a potential there. On the loss of employer union group coverage, LEC, that's probably the most common one we see. That one or FEMA for sure right now. Any other SCPs you guys can think of that you utilize regularly? Some of you guys that are writing vets? OCC, other creditable coverage. So OCC, other creditable coverage, isn't loss of creditable coverage, but it just signifies that you have some sort of other creditable coverage. The reason they want enrollment periods to get into plans is because they're not underwriting a lot of these plans. So they have to have an enrollment period to get in them so people don't just wait until they're sick to hop on one. In case you wondered why an enrollment period exists. It's to protect the book from people just saying, I'm not going to get any insurance. Oh, I'm sick. I think I'll go sign up for everything now. Now, there's so many enrollment periods, it gets pretty easy to still do that, but hopefully to take them away. When I started, like, the only SEP that really existed was loss of employer union coverage. That was pretty much it. Nothing else ever was utilized, right? And we didn't have LIS. That's another special enrollment period, low income subsidy. Once a quarter, somebody, because they're low income, can change their dual special needs plan, Medicare Advantage plan, drug plan. They don't have to be fully Medicaid eligible and be eligible for a DSNP. They could just be LIS and on a traditional Medicare Advantage plan or a PDP. All right, let's go. GI. This is why I started this, because I did see a lot of confusion on the GI stuff. GI is, so everything that we're up to this point on is mostly related to Medicare Advantage or Part D. Normally when you're doing GI, you have different types of times where you would use the GI code. So there are some products that are just always guaranteed issue, like dental, vision, and hearing plans. So anytime you write a dental, vision, and hearing plan, you just put GI. It's guaranteed issue. There's no underwriting, there's no enrollment period, nothing like that. It's guaranteed issue. Another time would be if you're writing a HIP on someone who's in that age-based guaranteed issue window. So let's say they're like Heartland Nationals is 64 and a half to 65 and a half, they're guaranteed issue. So they could, if you were enrolling in that period, you could do a HIP GI. Almost any other time, the HIP is going to be what? If it's not GI, what is it, Jared?
Underwritten.
Underwritten, that's right. What's another guaranteed issue product? So MedSup is going to be guaranteed issue like the way that we described last week. So I'm going to do a little tangent and then come back to those. Well, let's go through MedSup GI one more time because there were some people that were, I think their head was exploding, but MedSup guaranteed issue. So first of all, break all Medicare beneficiaries into two categories. And the defining difference is Part A eligibility date. If they were eligible for Part A, I mean, they have a part, not just eligible and signed up for Part A of Medicare with an effective date of December 31st, 2019 and before, anything before January 1st of 2020, then their guaranteed issue Medigap plan is Plan F. Okay? If they're eligible for Part A, their Part A became effective January 1st, 2020 or later, then their guaranteed issue plan is G. Okay? This is CMS guidelines. They created which plans you can get without answering health questions. Now, you still have to qualify for that. So GI rights are 63 days, 63-day windows, 63-day GI window based on certain events. One, similar to the special enrollment period for drug plans and Medicare Advantage, the loss of employer union group coverage also triggers a Medigap guaranteed issue right. So let's say somebody is turning 67 right now, so their Part A effective date was 2 years ago in early 2020, and they activated their Part B at that point too, even though they were on group coverage. So now they have no turning 65 open enrollment. They have no Part B open enrollment for Medigap. So the only way they could get a plan is through underwriting or a guaranteed issue window like they have, right? So because we said they were eligible for January 1st or eligible for Part A after January 1st of 2020, their guaranteed issue plan is Plan G. The first thing I'm going to do is try to underwrite them. But in order to technically get them to qualify through underwriting, I need to really be submitting a plan besides G. Because if you're submitting G, it's a little fishy to submit G underwritten, and then when they get declined, go back to the same carrier and be like, never mind, they were guaranteed issue. You can do that. But really, if they're answering health questions, you don't want somebody that knows they're guaranteed issue to get a decline letter from a carrier, right? But you can convince them that Plan F, I'm sorry, not F, N, well, I said F. Plan N is an appealing option to consider, right? Why is Plan N an appealing option to consider, Tammy?
Because it is cheaper.
Cheaper,
Rate increases.
slower rate increases historically. Okay. That's the primary reasons. There's obviously a pitfall with the excess charges difference, and there's some co-pays, but the premium starts lower and goes up slower. And even if it went up at the same rate, it would technically go up slower because the percentages are of the starting premium, which is lower, right? Now, for us too, if we convince somebody that doesn't qualify for open enrollment but qualifies for this GI right for Plan G, that we should first try to get them a Plan in, then you're perfectly ethically submitting an underwritten application. You can always tell them, hey, we can always go back and use your guaranteed issue window to get this Plan G if they don't accept you on Plan N. But if they accept you on Plan N, you're going to have, slower rate increases most likely, and your premium's going to start out a lot lower. And then, you can always resort to if I was writing my mom a plan, it'd probably be Plan N. I have a couple of videos out there that are titled that. Which plan would you write your mom? And it goes to Plan N. So anyway, that's GI. Now, if they were eligible for Medicare before January 1st of 2020, they had a Part A date of that. And let's say they're 75 now and they don't have an open enrollment period because they delayed their part, or they didn't delay their Part B. Does everybody get that difference? The reason that you use GI and MedSup is the people that didn't get off their employer coverage typically, but they went ahead and activated Part A and B. Anytime you see it, it sucks because you're like, was it going to be so easy? I could write you whatever I wanted to, full commission, open enrollment, no health questions. Great. But you screwed up and paid for Part B all these years for no reason, and now you're getting hammered. But that's okay. They're eligible. Part A effective date before January 1st, 2020 for a Plan F guaranteed issue. And I can convince them that Plan G or Plan N is an option they should consider, which is pretty easy to do. And then you can submit them underwritten to either one of those if their eligibility for Part A was January 1st of 2020 or before January 1st of 2020. Does that make sense? I know what you're dealing with is law on top of law on top of law. They just keep making new rules, and so you're kind of dealing with guaranteed issue rights came up with at this point. Then they decided Plan F has to go away for people who become eligible after January 1st of 2020. So then the guaranteed issue rights had to change to where it's like now you have two different sets of guaranteed issue rights. Those who are eligible before January 1st, 2020, those who are eligible afterwards. It's one of the more complex scenarios, and you don't really see it that often. But if you can submit those underwritten, that's ideal. If you do them GI, you, me, and the whole world gets paid less, and that sucks. And it doesn't really help the consumer that much either because you just threw them GI into a block of GI business that's likely to go up. Now, that's a little theory, by the way. If Plan F and Plan G are the plans that are having to absorb all the guaranteed issue business, what would you think if you had underwritten business where they get to ask health questions before they accept them, open enrollment business, I'm turning 65, or GI, I delayed Part B, I'm in my 70s now, and I need to get on a plan, but I have to use a GI right because I can't pass underwriting. Which one of those three groups do you think is the most expensive for the insurance company? The guaranteed issue ones. Okay? They recognize them as the most expensive. So the blocks that are getting the GI business, the theory would be that they're having to absorb that. Plan N doesn't get any of it. It only gets underwritten in open enrollment business. So conceptually, it would be better on rates over time. Now, you can't say any of that definitively, but all right. Now, going back. So we recognized when we would put GI in there. Pretty much a dental policy, a random GI window for a... All right. And then, of course, the Medigap GI right. So those are the times you use GI. Underwritten, you're going to use any time you have to answer health questions. Right? Period. Not a health risk assessment, which does make my whole rule obsolete. But anytime you have to submit it, to submit the application. The health risk assessments afterwards are a whole different thing. By the way, who's filling out their health risk assessments in Sunfire? You should. If you do, then we get paid more.
Yeah.
Okay. They're at the end. They takes you 5 minutes. You go through and answer them. All right. Now we got open enrollment, or OE and OEP. OE and OEP get mixed up probably more than anything on here. Where's my damn back?
I think to me, IEP and OE are the two most confusing ones towards each other.
Yes. So OE will never be used for Medicare Advantage or drug plan. It's just it's only for MedSup. Open enrollment is only for MedSup. It's Part B open enrollment, so their Part B date is within 6 months or they're turning 65. That's the only time you use OE. OEP, unfortunately, will get used for two different things. Any Medicare Advantage plan submitted with an OEP enrollment period or code, meaning they're changing, if they were changing from one MA to the other in January 1st to March 31st, that is OEP. Now, so some of you guys might be using SEPs during that period as well. You don't have to if they're already on a Medicare Advantage plan. The only reason you really need an SEP during OEP is if you're changing them from Medicare to Medicare Advantage. So, but OE, Medicare Supplement, Open Enrollment, OEP, MA, also ACA from November 1st through January 15th is OEP. We don't currently separate those out. Now, SCPs, you still have some ACA apps doing, like if somebody qualifies for the federal poverty level special enrollment period, you're still using SCP for that. There's just a couple of random ones. General enrollment period, which I believe there's some changes to it, so I'm not even going to hit on it. But the concept of it before was somebody that had no creditable coverage and then delayed their Part A and B or Part B and wanted to enroll in the middle of the year would have to wait until the general enrollment period.
It's still the same. It's March 1st or January 1st through March 1st. The difference is when you sign up, it starts the first of the following month you signed up now
Okay.
instead of July.
So if somebody comes in August, they have no creditable coverage, they've been on Medicare for a year, and they have no Part B active, they're going to have to wait until general enrollment period, March 1st and March 31st, overlaps OEP, to enroll in Part B. It's just used to, it would go effective July 1st. Now it goes effective the first of the following month. I don't know why it was ever July 1st other than just to punish the people for not being proactive. ICEP. Somebody explain ICEP. You know it, Stephen?
Yeah. So ICEP is the initial coverage election period, meaning this is the first time I actually qualify to enroll in a Medicare Advantage plan, right? So the scenario would be I sign up for Part A at 65, I delay Part B enrollment, and when I go sign up for Part B, right, say I'm 67 and a half and I sign up for Part B, my Part A and B are different, so I can't use IEP, right? So if I was going to enroll in a Medicare Advantage plan, it would be my initial coverage election period, first time I'm going to a Medicare Advantage plan. However, if you use the PDP, you would use the SEP to enroll in the PDP for loss of eligible coverage, right? Because there's no special enrollment period to sign up for Part B outside of your loss of eligible coverage. So if Part A and B are different, you're always going to use an SEP. Unless you're signing them up for AMAPD for the very first time, then you would use the initial coverage election period. It's the most confusing election period that we have.
Yeah, that's why I got you to explain.
I'm saying, I don't even know that I did a good job or did it any justice. But the way I remember it is if it's the first time that you can sign up, like I said, Part A and B are different. If I'm enrolling in a PDP, I'm going to use SEP. If Part A and B are different, then I'm probably going to use an ICEP if I'm.
One of these days, it'll happen to every one of you where you'll submit something, like in this case, with the wrong enrollment period, it gets slung back, and then you'll realize, oh, it was that one of those random ICEP scenarios. Yeah, typically, one of the reasons it's so rare for us is most of the people that I find that delayed Part B past Medicare eligibility and continued to work end up getting a Med Sup, so we don't even use it that much. But if one of those people delayed Part B, worked until they're 70, activating Part B now their Part A and Part B dates are different, and they decide they wanted a Medicare Advantage plan, then you use ICEP. The drug plan, like he said, would still be special enrollment period, loss of employer union group coverage.
To clear that up, so if delay Part B, they go on the Medicare Advantage plan, and they delay the Part B is ICEP. If they're going on the more traditional route with Medicare Supplement, it would be OE with a SEP.
Loss of employer union group coverage.
For the drug plan.
Yep.
But OE would be the med sub.
Yeah, it would still be, because it'd be Part B open enrollment for the med sub. So it'd be OE. Yeah. So ICEP is only for first time Medicare Advantage enrollment where the Part A and B effective date don't match. It's the only time you can only use it for Medicare Advantage, cannot be used for drug plans.
Will write us a song about that, please.
Yeah. ICUP, you gonna need to use ICEP. I'm onto something. Also, if someone has a Part B, if somebody has a late enrollment penalty, period, from disability Medicare, for like, let's say they didn't get a drug plan when they first became eligible for disability Medicare, then they got one, they have a late enrollment penalty, and then they turn 65, it goes away. Yeah. Pretty neat, pretty nifty. You'll run into that. Is it cool? Y'all want to hear something super cool? Yep. Medigap guaranteed issue rights.
You kidding me, man? This is the greatest conference all time. It's like nothing I've seen before. Coming back next year. The business is rapidly changing, and if you're not educating yourself, you're going to be left behind.
Great thing about Medicare Con and really any of these types of events, this one's so big, is you have all these people from chasing different pursuits in their business coming together and joining and sharing information. That's the best part of this. The conversations I've had with these guys right here, things that I wouldn't get just talking on the phone or anything like that. And the content here, it's been awesome. And Justin's done a great job, man.